What is normal skin health?
Normal skin health. So when you look at skin health, some people think it's just about what you put on your skin, but they don't think about what they actually eat can influence their skin health, whether that sleep can influence their skin health, stress levels. So it's not just external, it's also internal. So it's very important to consider your internal health as much as what you see on the outside.
And what is the most important things women, especially perimenopause, menopause age, should look out for not to disrupt their skin barrier?
Number one is do not follow trends, especially if you're like on TikTok or listening to some influencer that uses certain product, because everyone is very different. And I would say if you have a damaged skin barrier, work on that first before working on your pigmentation or aging skin or anything else.
So how can women during that stage of life can protect their skin barrier, like a skin microbiome?
So when you focus on repairing the skin barrier, you're also helping the microbiome. So you don't look at them as a separate thing. They are both, so if one of them is affected, the other is affected as well. So by looking at your skin barrier, hydrating your skin, focusing on ingredients that strengthen the barrier, such as, let's say, glycerine, panthenol, and ceramides, those are very good ingredients to hydrate and strengthen the barrier. You also are helping the microbiome of the skin. The microbiome of the skin also loves food like we do. There are skin brands that have prebiotics in them, and that's basically food for the microbiome of the skin. But you have to also be careful. Not every marketing term is what it says. There is a lot of brands that claim to be probiotics, but they're actually prebiotics rather than probiotics.
Hi, my name is Dr. Nguyen. I am a menopause and lifestyle specialist GP based in London. I started this podcast to help women over 40 to understand more about perimenopause, menopause, and the related problem that can happen during this change in their life. Today, I am joined by my colleague and friends, Dr. Nadia Hussain, to talk about skin and hormone connection. So, Nadia, how are you?
Hi, I'm very good, thank you. How are you?
I'm fine, thanks. So, tell us more about yourself and how you get into skin health.
Yes, of course. So I'm a Dr. Nadia Abu Hussain. I am a GP by background, but I'm also a functional medicine doctor. My special interest is skin health and looking at gut health, hormone health, how that affects the skin. Also looking at other factors such as sleep, stress, and what people use to put on their skin, how that affects their health overall, their self-esteem. And I have that sort of interest, getting a bit nosy about people's lives.
Yeah, so we both practice similar approach because I'm a lifestyle physician and you have the functional medicine training. So what we look at is like more like a holistic approach, isn't it? Like finding the root cause. So tell us more about how that approach, functional medicine approach is different from conventional approach in terms of skin care and skin health.
Yes, of course. So conventional approach, what we practice, you can say in GP land, is great for acute management, for diagnosis, prescribing medication if needed. However, functional medicine approach is, you can say, broader. You explore root causes of why something is happening. You dig a little bit deeper. It's like being a bit of a detective, looking why something is happening rather than treating just signs and symptoms, what you see in front of you. And the root causes could be anything from gut health, hormones, someone's lifestyle, whether that's their diet, their sleep habits, or what they put on their skin. So it's multifactorial.
Yes. So with the perimenopause and menopause, we know that a lot of changes happen during this stage in the woman life. So there is a decline in female sex hormone, obviously, but it is more than like a reproductive function, because perimenopause, menopause definitely affect all over the body and different tissue, including the skin. So in your practice, do you see any specific concern the woman raise during perimenopause, menopause?
Yes, of course. So women in perimenopause or menopause, they experience dryness more than normal, sensitive skin, sometimes dullness, sometimes hyperpigmentation. So they notice that their skin is so different from what it used to be in their 20s or early 30s.
Yes, so that's completely true in my practice too, because I see more from like a menopause and hormone health approach, but they do come with like a skin symptom also, like they talk about all the things that you mentioned, yeah?
Yeah.
So yeah, that's really important for us to understand about the connection between the hormone and skin, isn't it?
Yeah, definitely. They also complain about loss of collagen.
Yeah.
So they feel like the volume of their face is kind of shrinking, you can say, or like they have like their skin is not as elastic as it used to be. And that all has to do with hormonal changes and decline in estrogen.
So yeah, I read about from like a several dermatology literature. Basically, they said like more than I think 30% collagen loss in the first 5 years after menopause. So
Yeah.
collagen production significantly reduced
It does, yeah.
after menopause. Predominantly because of the decline in estrogen.
Yeah.
So that's what we saw that in the
Yeah.
literature also.
Yeah.
So let's talk about the basic. So what is normal skin health?
Normal skin health. So when you look at skin health, some people think it's just about what you put on your skin, but they don't think about what they actually eat can influence their skin health, whether that sleep can influence their skin health, stress levels. So it's not just external, it's also internal. So it's very important to consider your internal health as much as what you see on the outside. So for example, people underestimate how important it is to eat protein for the skin elasticity, for collagen production. They underestimate how important it is to get all the nutrients, because that also gets involved in collagen production. They underestimate that sleep is important, because if you are not sleeping enough, that raises your cortisol levels, which can also indirectly impact your skin. So yeah, it's very important. Your skin is the biggest organ in your body, so it's as important looking after it as any other organ in your body.
Yes, so you're right, because it's not only about the layer of the skin, it's about like what is inside in our body that can reflect on the skin, isn't it? So in terms of our skin layer, so we do have like a different layer of the skin. And nowadays people are more aware of things like skin microbiomes and skin barrier.
Yeah.
So with your background in dermatology and aesthetic for skin health, tell us more about the skin microbiomes and skin barrier.
Yeah, so the foundation of my work is repairing the skin barrier, and also working with products that are that also are healthy for your skin microbiome, or work with the ecosystem of your skin, because a lot of the products may not be as good for the microbiome of the skin. They may lead to something called dysbiosis, which is imbalance in that skin microbiome. So the skin barrier, what's the skin barrier? It's the outside of the skin. So it's think of it as the shield. It's what protects your the deeper layers of the skin. So if you damage your skin barrier, you start seeing signs of sensitivity, irritation. You start having sensation of burning, stingings, and you might end up with redness or blotchy skin, or some even breakouts, or increased oil production. So that's your skin barrier. The skin microbiome, so you have bacteria on your skin that lives on there, and that's normal. There is viruses, there is yeast, there is fungi, which is all very normal and supposed to be there. But what skincare may do to it is disrupt that balance, and that imbalance can cause then further issues, and that includes breakouts, increased sensitivity, increased irritation, and all sorts of problems. And we see also these days, especially in people with chronic skin conditions like acne, eczema, psoriasis, or rosacea, that they do have imbalance in that microbiome of the skin.
That's really interesting, isn't it? It seems like it's a new area of research, and lots of people are getting more aware, including the clinicians and public also getting more aware of the skin microbiomes. So, like you mentioned, that what is the most important things women, especially perimenopause, menopause age, should look out for not to disrupt their skin barrier?
So number one is do not follow trends, especially if you're like on TikTok or listening to some influencer that uses certain product, because everyone is very different. And I would say if you have a damaged skin barrier, work on that first before working on your pigmentation or aging skin or anything else, because if your barrier is not strong and you start hitting it with strong actives, you're going to cause more damage and you're not going to end up with the result that you want. So working on the skin barrier is very important. And perimenopausal women and menopausal women, they should focus on actives that increase the hydration of the skin rather than irritate it or cause inflammation. Or even resurfacing. Some degree of actives is okay if the skin barrier can tolerate it. But in a compromised skin barrier, the most important thing is working on repairing that skin barrier.
Yes, so it's really important, isn't it? Like just to personalize and individualize your skincare routine, and like you mentioned already, like not to follow the routine, like a trend things on the social media. So how about the skin microbiomes? Like during that changes, perimenopause and menopause, because of the decline in estrogen, there can be reduced in collagen, elasticity, more dryness. It can affect the skin microbiomes, like how the bacteria balance it on the skin. So how can women during that stage of life can protect their skin barrier, like a skin microbiome?
Yeah. So when you focus on repairing the skin barrier, you're also helping the microbiome. So you don't look at them as a separate thing. They are both. So if one of them is affected, the other is affected as well. So by looking at your skin barrier, hydrating your skin, focusing on ingredients that strengthen the barrier, such as, let's say, glycerine, panthenol, and ceramides, those are very good ingredients to hydrate and strengthen the barrier. You also are helping the microbiome of the skin. The microbiome of the skin also loves food like we do. There are skin brands that have prebiotics in them, and that's basically food for the microbiome on the skin. But you have to also be careful. Not every marketing term is what it says. There is a lot of brands that claim to be probiotics, but they're actually prebiotics rather than probiotics, because the term probiotic means live bacteria. So you put in something that is alive on your skin, but majority of those are fermented or extracts, and they work as probiotic rather than a probiotic. So yeah, being careful, choosing the right skincare, asking an expert or like a skin health professional that could advise on what to use. I work with a skin company that use live probiotics. It's called they're amazing in their research and their products. So what they have is they have probiotics, live bacteria, and that can help shift the balance of the microbiome on the skin towards the healthier, more beneficial side. And you notice improvements over time in improvement of the quality of the skin, skin tone, even if there is some pigmentation and even breakouts. It's not an overnight fix, it's a gradual change, but it's worth it because it's for the long term. Whereas if you start introducing active ingredients and you're not knowing what you are doing, you may see some difference at the start. You might have some benefits from it, but you also could cause damage, and it's for the short term.
Yeah, so thinking about the more long-term approach and what gives you the most benefit, isn't it, in terms of when you start choosing your skincare products? And thanks for sharing the product that you're already familiar with, and we can put the link down below. But of course, everybody should follow their individual sort of like a plan. So if you have any specific skin concern, it is best to talk to your skincare specialist or talk to your doctor, who will give you the personalized sort of like a skincare plan and make sure that it's not make you more sensitive or things like that. Yeah. Okay. So so thanks for sharing all the useful information about how to protect the skin barrier and skin microbiomes. So we like to talk more about like a hormone and skin connection. Yeah. So in my practice, because I am a menopause specialist GP, and I can see that from all the literature and all the things that we understand in terms of perimenopause and menopause, the predominant hormone that can affect the skin is the estrogen. Because our skin has a lot of something we call estrogen receptor. They are the one which will bind with the hormone, and then they can help with the skin integrity, moisture, elasticity, and collagen protection. So the decline in estrogen during perimenopause and menopause can cause significant change in skin health. And the other hormone is progesterone, right?
Yeah.
So with the progesterone, what we call is the calming hormone, and it can also help with the definitely skin microbiome balance. So we do see progesterone can also help with the sebum protection, like oil protection. So they also have progesterone also has a role in terms of maintaining a good skin condition.
Yeah.
We can't forget about the third hormone, testosterone, in women also.
Absolutely. Yeah.
Testosterone is like a very small amount in our body, right? But it can also help with the skin, although people worry that testosterone will give them more acne or more sort of like an oily skin.
Yeah.
With the woman, what they have is like a very small amount of testosterone, and that will help them to have like enough sebum protection, which means there will be more moisture and sort of like a protective barrier for the skin also. So in terms of having the balance in all hormone is quite important, isn't it?
Yeah, absolutely.
So I want to talk about, let's say, hormone imbalance.
Yeah.
We all know that perimenopause, menopause is more like a decline in estrogen causing this. But women can have things like, polycystic ovarian syndrome, which we all know can affect the skin significantly.
Yeah.
And these women, when they go through perimenopause, menopause, also the imbalance can be intensified, isn't it?
Yeah.
So share your experience about those group of women who has PCOS.
Yeah,
Called,
yeah.
oh yeah, sorry. We did
PMOS.
have a term change, and I'm so used to PCOS.
It's hard to know.
Yeah, so we change it to PMOS.
Yeah.
Tell us more about PMOS.
So PMOS, yes, I see a lot of my patients with PMOS. I suffer from PMOS. I'm so happy with the term change. It's just now it's involves more than just what people think that it's just cysts on the ovaries. It definitely gives you a lot. It's more than that. And my patients with PMOS, they suffer with imbalance in hormones, like you said. Majority of them have increased androgens, which is testosterone. And like you said, testosterone has, indirectly, it does increase the sebum in the skin, hence why those patients suffer from breakouts and acne-prone skin. when you balance those hormones, whether that's through supplementation, lifestyle changes, although it's not an easy work, where people should not underestimate the work that you put in to balance those hormones, you notice definitely changes in the skin, in the quality of the skin, in how it feels, in the skin barrier. It becomes more calmer, there's less breakouts, and it's just overall it does change with the balancing those hormones. Also in PMOS, some patients suffer with low progesterone, which is very important for your skin as well. And when that is low, also you notice that there is a degree of dryness, a dullness in the skin. But once that's in balance, you notice that the hydration is restored, there is more elasticity and better quality in the skin. With estrogen, some of the PMOS, I'm still not used to saying it, PMOS patients have estrogen dominance rather than decline in their estrogen. So it's kind of the opposite to menopausal women, but also estrogen dominance gives issues as low estrogen. It's more towards like having acne prone like skin those sort of skin types.
Yeah, so the main point is like to get the balance right, isn't it, for individual women? Just like you said, sometimes some women might be estrogen dominant, some women might be more inclined to have a low progesterone, some women might have more testosterone. In terms of the imbalance, things more androgen activity, yes, happening in their skin that's causing them disruption in the skin health and causing more acne and stuff. Yeah, so that's why our skincare. And the same thing with the hormone health. They are all very individualized and it has to be personalized and looking at the root cause, looking at the whole picture and try to make a personalized treatment plan, isn't it? So, yes, so that's really a good point that you made. So we talk about PMOS, and nowadays, like a perimenopause and menopause, based on several research and literature that we do, it's also not only the like I mentioned, reproductive organ. We also have elements of endocrine disruptions, including it can also interfere with thyroid hormone, and also we have to bear in mind like it's also affect the metabolism, so metabolic dysfunction, and which means like there can be a problem with the control of the sugar balance, like insulin resistance, isn't it?
Yeah.
So tell us more about how skin can reflect what's happening in our body, just like, disruption in the endocrine system like thyroid hormone, cortisol, and also, like we mentioned, about the inflammation and insulin resistance in general.
Yeah.
So, break it down a little bit for us, like how it can affect skin.
Yeah, sure. So when we think about hormones and skin, it's not just one thing. So they all interact with each other. So if your thyroid is not balanced, then potentially there is an issue with the your cortisol. Potentially there is some nutrient deficiencies, or even like genetic factors playing. If there is it's Hashimoto's, for example. When it comes to thyroid disease, if you are hypothyroid, meaning you are lacking the hormone that produces your active thyroid hormones, it means that your skin can be drier, can be more dull, and you notice that the elasticity of it is also not as good in person without thyroid disease. Also, if you are under active thyroid, you may have some rashes that are just out of nowhere came out. Majority of those rashes can be on the legs rather than anywhere else. So that's why investigating something is very important. Looking like why this is coming out, why it appeared out of nowhere, rather than just like looking at it and giving a cream or trying out something. That's why I love functional medicine, because you don't just look at something and give a cream or give a treatment for it. You ask why this has appeared out of nowhere, and you do your investigations, starting with blood tests, and that blood test panel is very extensive to see the root cause, if it can be found out through that.
Yeah.
When it comes to stress, so cortisol dysregulation, a lot of people these days are very stressed. Our lives are fast-paced. We don't get enough sleep. I'm not great at that either. At the beginning, your cortisol starts increasing, and that's basically like eating sugar, because if you have high cortisol levels, your body will start producing insulin. And when it's producing a lot of insulin, eventually you will have something called insulin resistance. So you're producing insulin and your body's not as responsive to it. And insulin resistance can lead eventually to type 2 diabetes. So it's a cycle, and one thing can lead to another, to multiple things. And that does have impact on the skin, because you develop a degree of inflammation. And when that inflammation is chronic, your immune system is not happy. And we know that your immune system communicates with your skin. Your skin is an organ after all. So you notice those differences on your skin. It's not becoming as elastic, as healthy. You start noticing that you are more prone to breakouts, to sensitivity, and all those things.
Yeah, so like you mentioned, it's kind of like you have to connect all the dots, isn't it?
Mm-hmm.
Like, similar to my approach in lifestyle medicine, we all look at the root cause, and it's better to look at the whole picture and then try to look at the different things of the lifestyle medicine factor, like a nutrition, sleep, stress management, and any other environmental toxins or anything that's contributing to it, and then look at all the things in the whole picture and connect the dot, and then try to make a better plan to improve your health and well-being, and particularly for the skin health. So yeah, thanks for sharing many useful information about insulin resistance and also cortisol level, and then how it can disrupt the skin health too. In terms of chronic inflammation, so one thing I learned from my lifestyle medicine diploma is you don't necessarily need to have a acute stressful situation to disrupt your system, especially your nervous system and cortisol level. So chronic low level stress can cause chronic inflammation. So that chronic inflammation, just like you mentioned, can affect the insulin resistance and how your body react to different things, and it can also show on your skin, isn't it? Because we all know that sometimes eczema or acne, they can trigger by stress. So that's why it's really important to understand how things are connected to each other. So with that in mind, because we're talking about chronic inflammation, so I just want to talk about gut microbiomes, because with the perimenopause and menopause, now we understand that gut microbiome can influence how we break down the hormone, especially the estrogen in our body. So there is a particular gut microbiome called estrobolome that can regulate the level of estrogen, because they break down and they try to recycle estrogen back in the bloodstreams. So I talk about that with my other colleague in my first podcast episode about the gut microbiomes. So we all know that there is more popular sort of theory about gut and brain axis. So one, there is an imbalance in gut microbiome. Sometimes it can lead to leaky gut, cause inflammation, because there are more chemical getting inside to your bloodstream from the leaky gut, and then that can cause the chronic inflammations, right? So that can affect how our nervous system is. So that has been quite well-known facts, a lot of research going on with that. That's why they are popular, probiotic, prebiotic products to balance the gut microbiomes. So in terms of the skin, yes, I just want to get your expert view on how gut and skin connection is there, and what are the research around it at the moment?
Yeah, sure. So, like I mentioned before, your skin also has its microbiome. And you mentioned the gut has microbiome, which is the bacteria, the viruses, the fungi, and everything else. And when your gut microbiome is not in balance, which we call dysbiosis, that triggers your immune system. 70% of your immune system is outside your gut. And when your immune system is triggered, it is in communication with your skin. Your skin microbiome gets that signal, and hence the imbalance in the gut can be projected on the imbalance in the skin. Like you mentioned, the term leaky gut, which is allowing things that are not supposed to go into your bloodstream through your gut. You could also have something called leaky skin. So your skin can also become leaky. So things that are not supposed to go inside your deeper layers of the skin, the bloodstream and everything, can seep inside as well. That's what we see in, for example, eczema flares or infected eczema. You have that imbalance in the bacteria on the skin. I've also noticed from my practice that people with stubborn acne, they have majority of them have imbalance in the bacteria of their gut. I saw lots of people with overgrowth of yeast. Some even had parasite overgrowth, which is not very recognized in conventional medicine. Whether you want to deal with this or not, that's controversial. But it's very interesting. It's quite new. It's not many studies are there to basically say that's what it is. But yeah, the research is very interesting, and you do see results once you start working on the gut, on the microbiome of the gut, improvements in the skin.
Yes, I agree with you, because I was looking into any evidence-based research around gut and skin connection, just like we notice now with the gut and brain axis. So the evidence is still not strong enough, let's say. And according to the literature, the oral, let's say, tablet probiotics, how much it will improve the skin health is still a little bit difficult to, confirm. So from my understanding, it is something that you can do as, complementary things on top of the skincare routine, designed by an expert like you, obviously, based on the individual and looking at the root cause of it.
Yeah.
Alongside the gut microbiome.
Yeah, I don't recommend my patients to just take any probiotic, because I'm a fan of testing, knowing what's happening inside your gut before just saying, yeah, try this probiotic. Because sometimes some people, if they have overgrowth of bacteria, which we call SIBO, or small intestine overgrowth bacteria, it's you can do more harm by just giving any probiotic than good, and you may cause symptoms in their gut, and then they will be put off working on their gut health. So testing is very important in that case, just knowing where you're at with your gut microbiome. Are you in balance? Are you lacking beneficial bacteria, or there is an overgrowth of something that was not supposed to be there? And working with a professional on how to deal with those things. And you have a lot of tests out there these days. Everyone is marketing some sort of gut test, but the ones I recommend are usually proper medical ones, and usually you work with a professional. You can't get those tests just by buying a testing kit online.
That's really good point that you made. So obviously, it should be the individualized approach, and the research data doesn't recommend it particularly, but it's all come down to case by case, isn't it? Like testing it properly with a medical professional, and then try to get the, our well-structured plan, looking at the whole picture, and then based on the test result and based on where you are with your skin and hormone, there will be a personalized plan people should follow, rather than just like you mentioned at the beginning, like following the trend or everything that is coming up on our feeds, like a different product, right?
Yeah. It is hard sometimes to resist those trends, but you gotta be careful because
Yes, definitely. So thanks for sharing your expert about this type of like a research and evidence around it too. So with the perimenopause and menopause, are there any different approach that you use if you have any woman coming in with a particular skin problem? Do you approach differently when you see a woman in their perimenopause and menopause stage?
Yes, so I like my first consultation to be a very extensive one. Like I can sit with someone for an hour or two, just knowing about the person as a whole, what they are experiencing, not just in terms of their skin, in terms of other symptoms. I want to know, is there brain fog? Is there some hot flushes? Is there some gut issues? How are the stress levels? Are they sleeping okay? So I want to know everything about this. And my approach usually, like I said, I'm a fan of testing. If there's any previous test, I would look at that. But if not, we need further testing for sure. That starts usually with an extensive blood test panel. I sometimes recommend a hormonal test, not blood test, but a urine dry hormone test. That's called a Dutch. That's quite common. There are different ones, but that's the one that majority of functional medicine doctors use to see the breakdown of estrogen, how it's breaking down. You look at your progesterone, our testosterone. It gives you a lot of interesting information. It's not similar to a blood test because the blood test just gives you a snapshot of those hormones at what they're at, and you can't make a lot of conclusions. But Dutch test gives you a better picture, whether you actually need to work on the hormones or not. Let's say everything is fine in terms of hormones and we don't need a Dutch test. I love doing gut testing. There is always something there. Even when someone tells me they're not really experiencing gut issues, but I always recommend it because you end up finding out something that you've been living with for a long time, and you're probably not knowing that that's actually causing a certain symptom. So I do the gut testing, and on top of that, when we deal with the internal factors, with the lifestyle factors, I love to look at what they're using, what skincare they're using, what they've tried in the past, what worked for them. I do a little bit of education about the skin microbiome, about the skin barrier, importance of it. Even if they are not keen in stopping their current skincare, but at least minimizing as many irritants to the skin as much as possible, and also being there for them, to support them throughout this change, because it's not a quick change, and sometimes it takes you probably, let's say, a month or two to start noticing something is happening. So just being there to provide them that support.
Yes, definitely. I think it's a similar approach that we have, right? With the menopause and perimenopause, also with the hormone treatment that we give, we always have to regularly review and then look at the progress, try to review certain things if the progress is not what we expected, and then based on that, you always adjust the treatment plan. And you can't ignore the fact of like a lifestyle medicine and functional medicine approach, just similar things that you do, just to look at the whole picture of good nutrition, good quality sleep, regular exercise, nervous system regulation like stress management, and looking at what we are exposing in the environment, try to reduce the toxins and chemicals as much as we can. So try to get the whole balance right in terms of, the skin health and also hormone balance.
Yeah. It can be a little bit overwhelming, all those changes, because there's quite a lot. So introducing things one thing at a time, doing those things gradually, and also it's not that you're supposed to be good 100% of of the time. You can allow your 20% to be, a little bit naughty, and not exercise for a few days. But making sure that 80% of the time you are living healthy and following all these things.
You make a good point. It's more about like a small and sustainable change. And then if you are at the beginning and trying to make some changes, then start one thing at a time. And then, be kind to yourself, obviously.
Yeah, definitely.
Okay. So now we are nearly at the end. So I just want you to share with my audience the final tips, like, what you can give to perimenopause and menopause women who are, let's say, are starting to see some changes on their skin, and then how they can protect it or how they can optimize, let's say, their skincare routine. As a daily, like a day to night regime, for example.
Okay, I think we can stay here for 3 hours talking about this.
Just try to summarize maybe.
Okay, so what I would give as a tip is being informed about what you are putting on your skin. Don't just buy a cream or have a cream on the shelf because, it's quite popular now, or it says doctor tested or whatever approved. Be knowledgeable about the ingredients. So always check the ingredients back of the product. Make sure that there is as little irritants as possible. Be knowledgeable about the different preservatives that could be added to the skin products that can be an irritant as well. And if there is any active ingredients, and by actives I mean retinols are quite popular, vitamin C is popular as well, knowing because there's different types of those as well. What they do to your skin, what are you applying exactly on your skin, is that working for you? So having that knowledge is very important, and reflecting, is your current skincare routine actually working for you? So if it's not giving you the results that you are looking for, or your skin is not feeling right, it's irritated, it's sensitive, it means that you have to make changes to your skincare. But don't just go and buy anything. Be informed before you buy anything, or stop anything from your skin routine.
Yeah, thank you. So my key message also is similar to yours. Definitely, try to make sure that you're aware of what you are using, especially for the skin that you're contact with. It's very important to check the product and the ingredient in it, and always use the personalized approach. So that's why it is very important not to follow whatever it is trending, and then try to speak to the expert like you, are expert, like, even if you have any concern with the hormone, speak to your doctor, medical professional who can, assess and review, make sure that they can give you a personalized individual approach, because every woman is different, everybody is different, which means like you can't copy and paste other people's plan. That's really important.
Making sure that you getting tested, and with the follow-ups also getting tested, especially when it comes to women on HRT. HRT needs monitoring closely, because it's not just one size fits all.
It is, yeah. So normally, like with the, whatever treatment plan that your doctors provided, obviously most of the clinicians will monitor it, review it, reassess it, and then make, modified plan, let's say, based on where you are. So that's why it is quite important to use that approach to look at everything and, our holistic approach, So thanks for sharing all the expert knowledge about it, and I'm sure our audience will find it very useful about optimizing their skin health. Yes.
Thanks for having me. I really enjoyed talking to you today.
Thank you.
Okay, take care.